Is it? Good afternoon or good night. I think in Japan is 3 a.m. In Kazakhstan is 11 p.m. 11:10. Yes, it's late night. And in United States now it's morning. And in Europe, it's a good time to take a glass of wine or one cup of nice whiskey or evening tea, cocktail. But we're continuing case number 5. But actually it's a case number 8 for today. 51 years old lady, young lady with this aneurysm in PCOM segment and choroidal segment, has an infundibulum. I just rotated and I called this Spider-Man or Patrick-like aneurysm. Okay, it's just a joke. Okay, let's take it out. Aneurysm looks like this, and very short segment before the ICA bifurcation. Yes, if we will put some coils, there is a risk of choroidal occlusion. Then we agreed with the Dawlet to place a FD stent, which will be fret X. We'll start from here. The design of fret is possible to start from the bifurcation and then go down. We need to use this possibility. Dawlet 3-ден алып тастайсыңшы? Ревью қоясың. Хедвейдің басын 45 градусқа бұра салу керек. Фем қосып қоясың. Distal ICA is 4.3 mm, proximal is 4.9 mm. 2D is more accurate measurement. Right side looks clear. Yes, it's unruptured aneurysm, and she was on DSA in one of the hospitals in Kazakhstan, and it was recommendation to follow this aneurysm for the next 6 months. But patient asked me to treat this aneurysm because of the fear from the aneurysm rupture, and yes, there is enough information to become very scary from the existing aneurysm, and the patient asked to exclude this aneurysm from the circulation. Very short segment between choroidal and aneurysm in PCOM. Yes, I forgot to introduce myself. My name is Mynzhylky Berdikhojayev, and with my colleague Dawlet and the operating nurse Zoya, with anesthesiology support, anesthesiologist Asıljan, and anesthesiology nurse. Video and company video support. We are doing this case in National Hospital, Presidential Hospital in Almaty. Patient under local anesthesia. Қорқпай жата беріңіз, мен Mynzhylkymын. Қазір аневризма көрініп тұр. Қазір стенд қоямыз, жақсы ма? Қозғалмасаңыз, Құдай қаласа, ойдағыдай өту керек бәрі. Okay. As usual, for this kind of intervention, most of the time, if patient agreed, we are doing intervention under local anesthesia, anesthesia local. And once again about Kaizen, I will never stop to talk about it because it helps to prevent any kind of complication. Yes, and with Davlet we graduated MBA in Almaty Management University, a Masters of Business Administration, and it was a lessons of Kaizen there. Yeah, okay. Davlet, you know the Kaizen? Yes. It was a very interesting story. It was 3 days of Kaizen courses, and at the day 2 in the morning, my wife called me. It was in 2021, the 13th of March. She was pregnant for our daughter, and she called me that she started to giving the birth and birth. I was in Astana on the courses, and she were in Almaty. It was at 10:30 in the morning, and I asked my teacher to allow me to go to the airport and to fly to Astana, to Almaty from Astana, because my wife starts giving the birth for my daughter. And my flight took off, departure from Astana at 11:50, and at 12:50 my daughter was born. And thanks to Maksat, my colleague, my student, and we are working together. He texted me that my daughter was born, and I was happy. I was really happy, and I missed a couple of days of Kaizen, but I think I'm too lazy, and I'm working from the principles of Kaizen. Kaizen is a strategy for the lazy people. And if you don't want to do the same things again and again, then you are trying to do small improvements to avoid the repetition of stupid steps, and to become the process more smooth and understandable. Stop. Smart mask. Okay, the A1 and ACOM is presented, which is good. Patient took Triventine, which is local ticagrelor. Local ticagrelor, and which is effective, and percentage of non-effectiveness, it's nearly 2%. Okay, now we are in the MCA. As usually, the wire navigation is not so sensible, but placement of the microcatheter in MCA territory might be a little bit painful. Stent aspirate. Yes, we asked to give a fret. I think you will agree with me because of this choroidal artery and choroidal infundibulum. It is quite risky if we will do stent assist coiling. Right. Yes, it's a Fretix, and usually we are ordering the Fretix, but some of our colleagues ordered the simple fret. That's why time to time the distributing company is taking regular fret, which is not good option. Okay, I think now is better. We covered a little bit the beginning part of the ICA, but then it's okay. It's a little bit overexpanded, but it's okay. Yes, I especially repositioned the delivery wire from the lower branch because the tip of the wire is tried to navigate to the small branch in MCA. Okay. To prevent the possible perforation and possible complications. Timer is on. It's good. Thanks, Dalit. I think now the position of stent good. We don't need to cover the M1 segment, but we could start from M1, but then stent may cover also the choroidal artery. But now I think the stent is nicely opened distally. I'm not sure we need to push it distally. For me, this position of the stent is acceptable. With other type of stents, it's also possible, but the segment between bifurcation until the aneurysmal segment is too short, and it may lead to stent displacement and several attempts of repositioning. Yes, I think I placed stent nicely. It's possible to push stent a little bit forward, huh? Зажимаем. Минус ходишь? Yes, we already covered the aneurysmal segment, and Yes, on lateral is okay, on AP it's look nice. We can push 1 millimeter forward, but I'm not sure it's necessary. Plus closer. On this image you can see the aneurysmal segment is covered. Ну-ка вперед. Yes, there is a slight stagnation. Okay. I will open the stent. Okay. Yes, the beauty of FRET, the distal and proximal is regular stent, and then the opening is usually very smooth. Yes, but the proximal part is a little bit not touched the wall. Okay. Oops. Let's take the Xeon Blue and we will do the massage, because the proximal part is not touched the wall of the artery, but the artery approximately nearly 5 millimeters. Okay, let's massage it. Yes, I did a pigtail, so wire, 14 wire, coronary, Xeon Blue and rodno vessel. Yes, the supraclinoid part is quite smoke muscles. Quite nicely opposed to the wall, but the big problem in proximal. That's why I'll push it a little bit. Yes, it's a purpose to push it a little bit or inside the stent. Okay, I think now it's better. Yes, it was the purpose. It's well opposed now. It's okay, it's good. It should be like this. And this stent is well opposed, and now the proximal part is opposed without any question. The wall position is better. Yes. Now we compressed the proximal part as much as possible, which is very nice oppose in the stent to the wall. Okay, I think now is better. It's a nice position. Yes. Very good all position, huh? Yes, I think it's very good. Oh, қатты жиналған жер ғой. The stent is maximum compressed. I have seen it from my friend Anlarat when we did the workshops in Ankara together in Tobeto hospital, and he did the maximum compression of the revo, and it's increasing the aneurysm occlusion, and the final result is usually better. More metal coverage. The stent is opened and lumen of the stent is okay. Now I will take to the common carotid. That's our usual algorithm. 10 minutes left from the stent opening. Stop. Yes, everything is okay. Now I will ask Davlet to do control CT and then control angio after. Так, субитой, да? Қоңырдың ішінде су бітіп отыр. Қазір мен ауыстырасам. It's very uncomfortable because of the 500 cc bottles. 1 liter is not available. Кастраты шығып кетейін. Стентіңіз қойып қойдық, бәрі ойдағыдай. Қорқпай жата беріңіз. Dear colleagues, control CT is ready. You can see the markers of fret, stent, distal and proximal. And the brain is clear, patient is awake, and we are communicating with her. And let's wait for the control DSA. Davlet is preparing to do the last DSA control on minute number 14. It's so-called modified Kazakh turbo test. Let's see. Everything is clear. Okay. Everything is clear. Aneurysm will shrink and disappear. It's a 5 mm story, and not 3 mm story. Okay. Just a second. Just a second. Okay, dear colleagues. Так, оң аяқтың басын қимылдатыңызшы. Басқа жағын. Хорошо. Қолыңыздың басын қимылдатыңыз. Хорошо. Жақсы ма бәрі? Басыңыз ауырып отқан жоқ па? There is no pain, everything is okay. The extremity is moving. And I hope you agree we can finish for today. 5 cases streamed, aneurysms, stenosis, and meningioma cases. And tomorrow we'll have again 4-5 patients with the brain AVM. Let's see what we can do. And thank you for watching, thank you for being with us, staying with us, and I wish you to enjoy the rest part of the day. Good night and good morning. Thank you. See you tomorrow.